I would like to welcome Dr. Sterling and Dr. McKnight. We certainly appreciate you being here with us. And just for a quick intro, we will be speaking about Q&As, basically questions that we have received from the community, the Peoria and Central Illinois community at large. And Dr. Sterling and Dr. McKnight have been wonderful to give us their time to help us to answer these questions. So I'm going to put us on a speaker view. And I will start, both of you, if you don't mind, just kind of give us some myths, some examples of myths that you have heard that we want to dispel this morning and right away. Dr. Sterling, we'll start with you.
Well, I hate this conversation because you can't disprove a negative, and there's so much whack-a-mole that we really should be engaged in, and it's so much more empowering to focus on facts and educating the community. But to that end, there are myths, and we have to meet people where they are. So I don't mind engaging in that part of the conversation. You know, the myths range from the inquisitive to ludicrous. There are things such as, are chips being placed in people, to, is this a remix of the Tuskegee syphilis experiments? You know, they're myths for a reason. The answers to these things basically are no. I mean, we hear, are people going to grow horns? Are there parts of the particle, the virus itself in the vaccine that will kill us? There are a couple of things to say here, and I'm gonna close with just two comments. One, I'm an emergency physician by training, and the consideration is that we don't focus on side effects to the extent to which there's a life threat staring you in the face. So even if there are myths that you have legitimate concerns about, and even if they were real, the threat of the virus is in front of us. It is killing hundreds of thousands of people, largely overrepresented in our community, and that's really where our focus should be. So I'm all for reasonable concerns, but let's not turn them into irrational fears, because that in and of itself is more detrimental than anything that the vaccine has to offer. I'll stop with this. You don't know anybody, and you don't know anybody that knows anybody who has ever died from the vaccine. But unfortunately, so many of our families have been impacted by the virus itself. So let's keep that in mind, even as we get information that's meant to calm our nerves and to empower us and provide us information and education.
Awesome. Dr. McKnight?
Yes, so I am the Director of Community Health Policy and Planning for the Peoria City County Health Department. So our office gets a chance to have those intimate conversations with our community about their concerns. And so I just want to address some specific concerns, I would say, about it that can also be looked at as myths as well. You know, can the COVID-19 vaccine make me sick with COVID? And the answer to that is no. The vaccine does not contain a live virus, so the vaccine cannot get you sick with COVID. So they're also saying that the vaccine was made too quickly, right? Like, oh, they just put it together and they just released it. But in actuality, this technology was already available, and the scientists had already been doing some testing and some trials. And so this was just a collaboration with scientists, the government, physicians, actually globally, to build all of this research to specifically address the COVID virus. So although the production of it was quickly, the data and the science has been here for some time. One last one, you know, will the vaccine alter my DNA, right? Will I turn into a turtle or, you know, a monster or whatever? And the answer to that is no. The COVID-19 vaccines do not interact with your DNA. So again, you know, these are just some high level myths. And, you know, and there's some, you know, people that are concerned about the impacts on if they get pregnant or if they are pregnant. We do encourage, you know, those that are expecting or will be to also get the vaccine as well. The risks are far greater if you don't get the vaccine and you are pregnant. So Again, that's just some high level myths that we've been hearing from our office.
Thank you very much, Dr. McKnight. So I am hearing, this is a question of access. I'm hearing that other people are coming into the neighborhoods and getting all of the appointments online much quicker than everyone else, which is then pushing out appointments for quite a few African Americans and, for example, people in the community. Can you speak a little to the idea of access to the vaccine?
Absolutely. So, as far as addressing people from outside of the community, as the health department, we do receive the vaccine allocation from the state, and we do have to work within our geographical parameters. So we've made the decision to partner with our with the Tri-County because we operate as a Tri-County as well. So that is Peoria, Tazewell, and Woodford. So all of our allocations is being shared. So what that means is if there is a resident from Peoria County, they can get the vaccine in Peoria County. But if those appointments are not available, they can also go to Woodford and Tazewell County as well. Outside of our Tri-County area, citizens are not eligible to get the vaccine. So we do get that information when appointments are scheduled. Now, as far as the access, where can I go to get the vaccine? So there are many places you can go. Like I said, Peoria, Tazewell, and Woodford County Health Departments are administering the vaccine. Our local health systems are administering the vaccines as well. That's OSF, Unity Point, and Heartland Health. And then in addition to that, our pharmacies are administering the vaccine. So as far as where do I go, where's the information, how do I contact? I highly recommend you go to our website, Peoria City County Health Department website, which is www.pcchd.org. Go to our vaccine page, and it has a list of all of the locations, the links to schedule an appointment. And also, if you don't have access to email or computers, you can call 211 and they will walk you through and help you with scheduling. So again, we are, doing appointments for those that live in the Tri-County region, and we are sharing our allocations. So,
Dr. Sterling, do you want to speak to this in a broader fashion? We're hearing again, Dr. McKnight just mentioned, not having access to computers and things of that nature. Perhaps it's an issue of access to information. I'd look to you for your thoughts.
First of all, of course they are. I mean, to your original question, while the African American community has been slow coming out of the gate due to those myths that you referenced and due to reasonable concerns based on things like the Tuskegee experiment and the Henrietta Lacks story, other communities saw the dollar signs or the equivalent of dollar signs, which said 95% effective, 94% effective, and thousands of people dying. They rushed to the front of the line while we were still experiencing vaccine hesitancy. So obviously, if there are opportunities and there are appointments available, many individuals who didn't have those concerns rushed to the front of the line and were accommodated. The vaccine wasn't going to be waste, so this is an example of where people took advantage of the opportunities. The good news in this conversation is that African Americans have picked up and gotten a clue and started to realize that we were being left behind unwittingly. And now that information is out there and the information campaign has become more successful, you see African Americans actually outpacing the general society in terms of willingness to get vaccinated. Now what comes is the logistics of, well, now how do I actually get the type of access that I need? Because there's some very alarming data that shows that the number one corollary with your ability to get the vaccine isn't your eligibility based on the criteria, but your socioeconomic status. So it is the people that have the wherewithal to drive to the various types of communities that Dr. McKnight was describing. It is the people that have the aggressive nature to call the city, county, or state departments of health every single day to see if there's any additional doses that can be obtained and then travel to where those doses may be given. Those are the ones that are pushing their ways to the front of the line. Unfortunately, what you saw in the African American community was not a level of mobilization that would have put us at an appropriate level of standing, given that we're so disproportionately affected by the disease. We should have been accommodated. But in politics, you don't get what you deserve, you get what you advocated for. So take the example of what you've recently seen with teachers forcing their way to the front of the line, and President Biden actually demanding that they would all be vaccinated by the end of March. There was no equivalent effort put forth by the African American community to make that happen for us. So those are the types of things that explain why we've been relatively less represented. And of course, that's just part of it. There are real social determinants of health and structural biases that have played into it as well. But we have unwittingly tripped over our own feet, and that has contributed to some part of the conversation. So the points that were brought up earlier, as well as a fundamental, my fundamental recommendation to people is that be aggressive, fight for your place in line, call the pharmacies, call the local hospitals, call the Department of Public Health every single day and see if you can get on the list, see if you can get an appointment, see if there are any doses that are going to be given out at the end of the day at risk of them not being utilized. That is how you get this dose quicker than you would otherwise get it. And we have to become as aggressive as other communities have been in doing just that.
Thank you very much. I really appreciate that vigor and insight. Dr. Sterling, since we have you, can you talk a little bit about the differences between the viruses, and eventually we may speak to some of the variants as well, and we're starting to hear more about that.
Okay, so you may have heard the phrase distinctions without differences.
Okay.
So at the beginning of the conversation, let's point that out. The three vaccines that have been approved in the United States are the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. It is very important to say at the beginning of the conversation that our three vaccines are better than any other vaccine being offered anywhere else in the world. So to tweak the differences between the three is really, to some extent, necessary. People want to be informed, and I want you to be informed, to realize that this is a plethora of riches that we have available to us. The most notable differences lie between the first two vaccines that were approved and the third. Both the Pfizer and the Moderna vaccines are what are called messenger RNA vaccines. And the easiest, there are many analogies that have come up, but I tend to like the one about the carrier pigeon, where really all you're doing is you are delivering a secret message to your body's immune system as to how to fight off the infection. It really is just that simple. And the technology of it all, I like to describe it more as innovation. We are so ready to rush and get a new iPhone every year, or to embrace other types of technology. Why would we not be thrilled about medical innovation? You call it technology, I call it innovation. The point of the matter is that we were able to make it to the moon. And I don't think that it was rushed as much as it was an efficient response to a pandemic. Would you rather we wait 13 years for this thing to be produced and then to die? So those are the Pfizer and the Moderna vaccines. They both come in at about 94 and 95% effectiveness in preventing moderate to severe disease from COVID-19 and death. That's what you need to know. The third vaccine is a Johnson & Johnson vaccine, which really takes an inactivated particle, and actually, you may have heard about the spike. There's a spike that penetrates the cells and then causes all kinds of devastation. That the vaccine actually delivers, it's kind of like ROTC in war training, to where you get a little taste of the battle that's to come, and then your immune system learns how to fight against the virus, and then when the real vaccine shows up, you're already prepared. So those are two different paths to the same desired end result, but the differences between them involve such things like, well, you know, the Moderna vaccine, these particles are so unstable. The messenger mRNA vaccines are so unstable that you really have to freeze them, because once they are at room temperature, they inactivate relatively promptly in like 6 hours or so. So they have to stay frozen, and that's why that occurs in that way. And the Johnson & Johnson is actually different. It can be at room temperature because it's not a piece of RNA, which involves, you know, coding. So there's some nuances in it, but, you know, focusing on the big picture, the long and short of it is that they both are very effective in terms of preventing death, first of all, and disease. And I'm going to jump ahead, if I may, and just real quickly answer a question that you should ask and that you probably will ask. There are concerns that are expressed about whether or not you can get the disease if you take the virus. It is very important to point out for all of these vaccines that the goal is not to stop you from getting infected. The goal is to stop you from dying. And that's exactly what's happening here in all three of these things. You can get a little cold or some equivalent of a cold based on COVID-19, but the ability to transmit the disease, the ability for it to replicate and then cause moderate, severe disease or death is what's being definitively knocked out to the tune of 100% based on studies that have come out of Israel on this. So the differences between them are all couched in good news across the board.
Okay, so I'm going to ask Dr. McKnight, you and I may stay on a little bit later because I want to talk some community details with you. But while we have Dr. Sterling, I just want to verify, once you get a vaccine, you cannot transmit the virus. Is that what you're saying? Is that correct?
No, that's not correct, actually. Okay. There is a difference. This is a difference with a distinction with a difference here. So we're talking about the ability to functionally cause disease. So think about it this way. If I get a vaccine and you have COVID-19 and you come up to me and cough and spit and holler in my face, there's nothing about a vaccine that's going to stop me from inhaling those respiratory droplets. So it's wrong to have a conversation about, can you not get exposed to the disease or can you not catch the disease? What happens once the virus is inside of you is what matters. And in order for the virus to cause the disease, it has to replicate. So much so that it then causes infections. That's what the vaccine stops. It stops you from getting disease. It stops the virus from replicating to the extent to where it causes disease. So if you come and sneeze on me, kiss me or hug me or other such things to transmit it, I can actually have some degree inside of me. And then if I turn around and kiss the next person, I can actually give them that low level of virus. And if they're not protected, then theoretically it can replicate in that next person. But inside of me, because I have a vaccine that prevents this virus from replicating to the extent of causing disease inside of me, I'm going to be protected. And we're upwards in the mid-90s to 100% effectiveness in knowing that once I am vaccinated, I am going to be okay. And one critically important point that flips the conversation on its head based on what we used to know, the concept of natural immunity, the amount of protection that's offered by getting the disease, surviving the disease, and then having antibodies that protect us. Typically, natural immunity is what that's called, is better than vaccination. In this example, it is definitive that the getting vaccinated against COVID-19 is actually more protective than developing a natural immunity from having had the disease and surviving it. So getting vaccine, that's the name of the game right here. It protects you in so many ways. And again, it's not about not getting the disease. It's about not dying from the disease. And that's what's being accomplished here.
Got it. Okay, thank you. So for someone who is in between or has had it, so for example, I had it. I was told that for 3 months that I was sort of protected, if you will. I had some antibodies in my system. So after 3 months or so, is it all game off? Am I completely, can I get exposed again in the same way to the same degree? Or
there was a study that was just posted in the last several days. I actually commented on it on my social media channels today. The amount of natural, you're a young woman, so this doesn't apply to you, but there's a fork in the road. At age 65, the amount of natural immunity that's conferred by getting the disease and surviving it drops like a bullet to somewhere in the ballpark of 47%. That's that's flipping the coin. So the amount of protection that you get from getting vaccinated, as we point out, is somewhere upwards in the 90s. So if you're at that 65-year cutoff, you have even more reason to be concerned. Now, the other thing that came out in the study, it was published in the medical journal, The Lancet, actually suggests that you have not those 3 months that we used to talk about, but you actually have about 6 months of protection. So functionally, we're now going to say if you get vaccinated that we know that the lower limit of how long this is going to last is 6 months instead of 3 months. So that's actually more good news. So kind of keep that in mind. You're probably going to find that if you've been vaccinated, if you've gotten COVID-19 and you're trying to get the vaccine now, people are going to push aside that 3-month waiting period that we had been talking about before. And again, if I'm in your shoes, I'm pushing to get to the front of the line. Let somebody at one of the vaccine centers tell you that they won't give you the vaccine, but don't assume that just because you've had the disease that you're protected. It's probably going to take you that long to get processed anyway. And we are at the point now to where the game is on to get everyone every adult in the United States vaccinated by May. So regardless as to whether or not you've had the disease, go for it.
So, and this question is for both of you, Dr. Sterling from a medical perspective, Dr. McKnight from symptoms or issues presentation perspective. Have we seen the variants or any representation of the variants in Central Illinois? And Dr. Sterling, I think about Johnson & Johnson, they're saying that it is more effective against the variants. Can we speak just very briefly about the variants and then Dr. McKnight in our Central Illinois community?
Well, we are in a race, literally, against the emergence of the variants and our ability to get people vaccinated. We've long said that by the end of March, we expect the variants to be the predominant cause of COVID-19 in the United States. And we're actually at the point now to where over half of the new cases of COVID-19, it's been exponential. The new causes of COVID-19 are now due to the variants. So what we are seeing, if you actually have paid any attention to the curves, you've seen a rather precipitous drop in the number of cases since the effects of the holiday travel that occurred. But that drop has now started to plateau. And what that plateau represents is the convergence of what would have been a fall due to more aggressive hand washing and mask wearing, sanitizing, et cetera, and the emergence of the new variants. They are here. And it remains to be seen whether the plateau is going to continue to fall, and it will fall as a result of more people getting vaccinated, or whether it will take off exponentially. These things are at least 20% more transmissible than what we had that was homegrown in terms of the disease. So, this spring break is an important fork in the road because with 1 million travelers, there have been 1 million people registering through TSA pre-checks or screening at airports every day since this past Thursday for the last 7 days. So people are oblivious, they're fatigued, and they're acting recklessly. And we just hope that the race comes out in favor of the more aggressive vaccines. We're over 2 million a day that's occurring now, and the more enhanced public health measures, masking, washing, et cetera, versus the recklessness of some of the citizens here. Time will tell. We'll know in about 3 to 4 weeks what the ultimate answer to that question is.
So, along those lines, there have been variants detected in our region. We are working with our health systems, and so we have infectious disease experts, epidemiologists that are tracking this data and feeding it back to the state, who is feeding it to the CDC. So we do have an established network for that. So just so the community knows is that we are observing that, we're tracking that data as well. And one point Dr. Sterling made that I want to emphasize is, the variants, this is a natural evolution of viruses, right? They're living entity, and they're fighting to survive, and they're adapting and mutating. So this isn't new with the virus. However, one thing we can do and what we can continue to do is to protect ourselves is in addition to getting the vaccine is of following the practices of social distancing, wearing our masks, washing our hands regularly, and building our immune systems. We can make our bodies stronger, right? So that is getting your vitamin C, getting the nutrients you need, getting more exercise, having a healthier diet and lifestyle. So all of those working together will add this defense um, to um, to this virus and its variants. So we do have things that we can do to control and to enhance ourselves. And it's not just protection for ourselves, but it's protection for our friends, our families, and our community as well. So it's going to take all of us to do everything that we can to really stop the transmission and the spread of this virus.
Well, I guess I have another
Uh,
reason now
may I
to.
jump in? Let me jump in. Let me jump back in on that because we've been talking about um, the vaccine, but I would be remiss, and this is how I spend most of my time, if I didn't point out that an ounce of prevention is worth a pound of cure. We call that stay ready so you don't have to get ready.
Amen.
Your baseline level of health when you get confronted with this disease or any other is what's largely going to determine your outcome. It is to a fault that Americans have been continually in search of a magic pill or magic needle that will wash our diseases away. But if and as we are prepared and healthy on the front end, that's the name of the game. Case in point, a very simple statistic for those that are still waiting for the vaccine. There's a 96% safety rate already there waiting to be had.
Mm.
If you wear a tight-fitting mask, the med-surg mask, or what we recommend, you don't need the N95. If you wear a tight-fitting mask and then cover yourself with a second type of mask of a different type of material, or you put on a face shield like this on top of it, and then you require the person that you are interacting with to do the same, you are literally 96% protected in real time for that interaction. So think about the power of that. If we simply engaged in that behavior by itself, then we probably wouldn't need to be having a conversation about vaccines anyway. And to the point of the whole masking conversation that Dr. McKnight was focusing on, in the 100 years since the Spanish flu epidemic of 1918 to 1919, the flu has been killing about 35,000 to 75,000 people every single year. This year is probably the lowest flu season that we have had on record. And that is simply a happenstance of us wearing masks more assertively than we have before. So it's all about prevention, folks. We'll get the vaccine, we'll take care of it, but keep in mind that so much of this is in our hands, and being empowered gets us where we want to be.
Wonderful. And then just quickly, I've been told that the Johnson and Johnson vaccine is more effective against variants than the other two, Pfizer and Moderna. Is that correct, or should we not even worry about that?
Get the first vaccine you can get.
Got it.
There's a distinction without a difference, but as I said, what's more effective than all of those is being masked and making sure those around you are being masked.
Got it.
Get the vaccine.
Get the vaccine. So of course we've been hearing still about, do we still need to wipe off our groceries? Do we need to, can it still be transmitted that way? Or do I need to wipe off the packaging in the same way that I did before?
Look, it's about risk reduction, okay? Everything is risk reduction. There's no 100% guarantee in any of this. And anything you can do to reduce the risk. Remember, diseases are expressions of risk. So if you have a 1% chance, then 1 in 100 is going to still get you. But if you have a 50% chance, you're pretty likely that it's going to happen. So
right.
I'm not going to criticize anybody that wants to do anything to lower their risk of acquiring the disease. So I'm not saying that you need to be stressed out and obsessed with it, but all the things that we should have been doing, it's amazing how many people have just learned how to wash their hands. So I'm here for all of that. Go forward, be safe, do whatever you feel like you need to do. Just don't stress yourself out over it. And don't stress other people out over it who have different levels of comfort with what they do than you do. But protect yourself.
Thank you. Dr. Sterling, I know that you had a hard stop. If you need to exit and go to your next meeting, again, I thank you for your time, and then I will then just speak with Dr. McKnight about stuff we need to do here locally.
Well, that's great. If you have a final question before somebody comes and grab me, I'm happy to take it. Otherwise, it's been a joy being with you. And
Well, just give us final thoughts, your final thoughts, and then I'll talk to Dr. McKnight.
I'm so proud of what we've done to turn the corner, and I'm talking about our community. Nationally, this has been a disaster, but we are doing better in terms of operational excellence. We finally are engaging in public health best practices. Just think about me for a second. You know, I'm an emergency physician, and I've been navigating hospitals for years with diseases like there are a dozen different diseases that have been trying to kill me for my 25 years in practice, and I haven't caught any of them. And that means that if I can navigate these things in a hospital, you can navigate them at home. And there's not some secret sauce that exists. These are the same public health best practices that we are trying to get you to engage in. So it's all about implementation. And we've only given you a couple of things: wash your hands, sanitize, wear your mask, social distance, and get tested when appropriate. These are fundamental things, and if you do them, you will come out on the other side okay. I do want to just point out that we as a community should just be torn up over the devastation that's occurring. And COVID-19 is special, but it's not unique. Our community always gets the brunt of these things. You know, when America gets a cough, we get pneumonia, as the saying goes. But we just have to become better stewards of our own healthcare. We have to be educated. We have to be empowered. Don't be guided by fear. Have your reasonable concerns. Don't let them turn into irrational fears. Get information, advice, help, but protect yourselves in the way that you see fit. Choices have consequences. And if you're guided by fear, bad things are going to happen. It is predictable. It's to be expected. And we already have been leapfrogged in front of the line to where our place should have been, but we're catching up. And just fight for your place in line. That's all I can tell you, because it is our mothers, it is us that are dying from this disproportionate than anyone else in the community, and we can do better, and we should. So if I can in any way continue to provide information to our community, feel free to reach out to me. You can reach me at jeffriessterlingmd.com online. Ask Sterling MD on social media outlets, and I'm just hoping for the best, because this is about survival. So best of luck. Thanks to the Links for having me and for all that you do. Keep up the great work, Dr. McKnight. I look forward to seeing you at the next chamber convention, and everyone be safe.
Thank you very much, Dr. McKnight.
Doctor.
Thank you all.
Dr. Sterling.
Good day.
Good day. Bye-bye.
All right. Dr. McKnight, I've got you all to myself.
Yay!
So, you know, with all that we've been discussing, I really want to put a question to you. What can we do? What we are, you know, we are members of this community all across Central Illinois. What can we do, one, as citizens, but as an organization, to assist you in your work to get the vaccine and information out?
Yes, I appreciate that. And so since it's just me, I'm going to take the time with this answer. So where we are with the vaccines, just so the public will know, there's different phases for us administering the vaccine. Phase 1A was more for our long-term care facilities. We are at the majority capacity in administering that vaccine. So we've moved on to phase 1B, which is the 65 and older that have comorbidities that are not in long-term care facilities. We have been very successful as a community in administering that as well. So now it is expanded to 1B plus, which is the ages from 16 to 64 with comorbidities. Comorbidities is pretty much pre-existing conditions or diseases. So that includes individuals that may have lung disease, obesity, kidney diseases. There is a full list on our website of these pre-existing conditions. But that means, now you are the priority group. And if you put the overlay of those conditions in that population with the African American population, that is the majority of us, right? Smoking is one of it, you know. So again, so my point is, this is our time, right? We are the priority group right now. So I will highly encourage everyone, while the vaccine is available at all these various locations, while it is still free, because we don't know long term, even if the vaccine is going to be free. But in this phase, and we appreciate the Biden administration and the Pritzker administration for these allocations, it is time to get the vaccine right now.
Okay.
Now, logistically, as far as we've been talking about how we can specifically reach the minority populations, and that's essentially the African American and the Latino population, as Dr. Sterling mentioned, which our population is the most disproportionately affected by this. What that means is that we are two or three, if we get COVID, we are 2 to 3 times more likely to die of COVID than any other population category. Why is that? Is because of our pre-existing conditions and lack of medical care. So this is our time to get it. We want to be even more intentional about having access and education to these vaccines. So I did a vaccine survey, and many African Americans participated. And one of the questions is, what will make you more likely to get the vaccine? Many of their responses, particularly for the African American community, is one, they would like to have more information. They want to be educated on the vaccine. Two, they want the vaccine to be easily accessible at no cost. And three, they want to have a conversation about the importance of the vaccine with people they trust. So you had asked, what could Link do? Link could continue to do just what you're doing, Dr. Jeffries, to have a vaccine campaign where there's education, where we're hearing from our people, our community, professionally as medical providers. Also, maybe hearing from those that have received the vaccine, so they can tell us if they actually had any side effects, how their wellness and health is, and why they decided to get the vaccine. So the more storytelling we can do about this, the more that people will start having a comfort level. And then we Dr. Jeffries, we have to combat the myth, right? We have to talk about the Tuskegee experiment because that traumatized us medically, historically, because it was an unethical practice and it was targeted specifically to African Americans. So we have to have conversations about the Tuskegee experiment and, how as a community we've been able to heal from that. I'm sorry, my phone is ringing, but we're just going to let that ring. I didn't turn it off. So we're going to decide how to do that. But then another piece is the access, right, Dr. Jeffrey? So we have all of these locations, but we need to be more targeted in the African American community. So in that regard, I will say for our Tri-County region and our vaccine allocations, right now the health departments, we are getting the Moderna and the Pfizer. So those are 2 doses, and as Dr. Sterling said, that there's specific refrigeration requirements. So there's a lot of logistics that's involved in this. That's why the health systems are administering it, and we've established an actual clinic, which takes some resources to do it. Now we are working with the state to start coordinating more mobile sites, which could be more in the churches or a social service agency or things of that nature. Now, what vaccine lends best to that is the Johnson and Johnson. So right now, the pharmacies who receive their vaccines from the federal government, because we receive ours from the state, they have the Johnson and Johnson. And as Dr. Sterling said, it does not have to be refrigerated. So it lends more to being able to administer in locations for a smaller group of people. So that's why the Walgreens, they partnered with Southside Mission just a couple of weeks ago, and they had this site. So we're in conversation with the pharmacies to see how we can continue that and have smaller mobile sites in our, Latino and African American communities so that we can meet them where they're at. So again, it's a dance. The more vaccines we can get, the more locations we can administer, The types of vaccines will determine logistically the locations and the capacity of where we can. So again, I suggest everybody just stay in tune, educate yourself, have these conversations intentionally with your friends and family. Highly encourage those to get the vaccines, and let's continue and let's be accountable to each other. Let's work together on how we can be more physically active, how we can have a more nutritious diet, and talk to each other about that. Right? We used to be a community that we would, pick beans and greens and cabbage and fruits, watermelon and vegetables. We need to get back to that. We need to get back to that because, as Dr. Sterling says, we are the best resource for ourselves. Wellness has to be our priority now. There are variants, and who knows if there'll be another virus in the future. So it is a war, it is a battle, but we are equipped to fight. So that is my long-winded answer, but I'm glad you asked it.
Me too. When it comes to the mobile sites, I really like the idea. Do we have a sense of timing on those mobile sites?
Not right now. Again, this is emergent. We are just at the front end, and honestly, even the availability of the vaccine
Okay.
to now expand and create these mobile sites.
Okay.
For the county, the Tri-County, we were getting like 1,500 to 3,000 vaccines a week for the entire Tri-County area. So that goes very fast once we give our vaccines to the health system. So once we give our Tri-County Health Department clinics, then we give to the health systems. It's not that much left, right, for that week. So we do appreciate the Biden administration and the American CARES Act. We do anticipate higher volumes of vaccines, particularly in our community. So right now we are in the planning phase, and we are identifying with some of our community partners. We're in discussion now on, mobilizing additional sites.
Got it.
So we're brainstorming all of that right now, and that's why I have, a group list now of African American stakeholders that I'm going to keep informed as we continue to proceed, because we'll also be available. We're available now actually to give presentations to organizations. So we have community health workers. If you want us to come out to your agency to talk with your staff or your clients, or your community stakeholders, we are available to do that as well.
Wonderful. Thank you. And just from a statistical perspective, do you have a sense of, specifically for our community, the amount of community members who have received, the percentage of community members who've received it versus the amount that still have to get it? I'm just trying to think of who's vaccinated and who's not.
Absolutely. That data is actually on the state's website.
Okay.
All of our vaccinations per population and demographics, we have epidemiologists that report that data to the state. The state congregates that data and posts it by county.
Okay.
So you can go to the state of Illinois, Illinois Department of Public Health website. I do not know that offhand, but that's where that is located, and it will let you know the percentage of our African American population that actually has received the vaccine thus far. I will tell you, I know generally that 17% of our population in total in Peoria County has received both 2 doses, and about 28% of our population has received the first dose.
Okay.
So we are actually ahead of the game. We're like at the top as far as percentage rates of those that are actually receiving the vaccine. So I want to commend everyone that has received it or is getting them and or getting the message out to our community about the importance of the vaccine.
That's wonderful. And again, I know your phone was ringing, and so I won't take up much more of your time. Dr. McKnight, do you have any parting words, or is there anything that you would like to say to wrap up our session?
Yes, I just want to say that people move in the conversations that they have. So we have to keep, we can't be cavalier about this time. We have to keep this on the forefront. It has to be important. It has to be vital. We have lost too many of us in our community. I have lost my uncle. My dad had COVID. He was this close for being on a respirator. And once you get on that respirator ventilator, you know, it's in God's hands at that point. There's nothing else medical professionals can do. So we are in an emergency crisis mode right now, and it's not over. Just because it's springtime doesn't mean that it's done. We are still in the thicket. We can go in either direction. Our rates, our positivity rates can go lower, or it can go back and plateau and be off the charts again. The direction of that is up to us. So I highly recommend we keep talking about it. If you have not received vaccine, to get it if you are in that eligibility period, and continue to talk with your friends and families about it.
Thank you very much. I am just honored that you took the time to be with us today, and I appreciate you, and you've certainly given our community members good information to think about, and I appreciate your insight. You have a wonderful day.
Thank you so much. I appreciate being here.
Thank you so much.
Have a good one. Thank you,
too.
Dr. Jeffries.
Thank you.
Bye-bye.